Untreated tooth decay causes pain and infection. It can lead to poor nutrition, lack of school readiness, and even speech problems. There's also a profound economic impact from untreated dental disease. The loss of school funding due to missed attendance, parents missed days at work, and costly emergency room visits. About 1/3 of California school children have untreated tooth decay. Ventura County has a similar story. In our county, more than 25% of children entering kindergarten have untreated cavities.
These statistics are particularly disturbing to me because we know how to prevent childhood caries. I still see tons of young kids every day that have dental caries. They walk around in pain and with infection, and it's avoidable.
In a recent survey of California parents of young children, only 1 in 10 knew to begin cleaning a child's teeth when the first teeth appear in the mouth.
Oral health has been a major focus of First 5 Ventura County since we started funding programs over 10 years ago. Dental caries is one of the most common chronic childhood diseases, and what's really sad is that they're really largely preventable. The statistics are overwhelming, and we knew early on that the only way that we're going to get ahead of this curve is to start early.
When you see what happens with low income, lack of education, cultural issues, you realize that you can't just leave this to dentists to take care of for the kids, because that's what you could do. That was a luxury when people all have insurance and they all have access to care. I believe it's absolutely critical that we address oral health in primary care, well-child visits, if we are going to make any kind of impact at all on children caries in Ventura County.
Without exception, I can tell you that if a child is not healthy and ready to come to school, we're not going to get the best performance out of them. We have seen some great success within our district of actually bringing the services in, and that whether that's preventative care or whether that's actually providing the service or the care that a child or a family needs, ensures that a child will be in school the next day, ready to learn. We ultimately see improved attendance, we see improved participation, and eventually improved academic performance.
It's sad to see all this decay on the kids, and it's even more sad to know that it's more the education part. There's a lot of parents that don't know, so I guess we have to do a better job educating parents. After we do all the necessary treatment, the parents come back and they tell me, you know what, Andres, after the education, everything you told me, the kid can sleep better, he eats healthier, he knows when to brush his teeth.
There's a great lack of understanding about oral health among many parents, and a lot of educating to do. Not only in treating the disease once it occurs, but in preventing it in the first place. One of the biggest problems is a lack of access to care and an understanding of how to access that care.
Pues es difícil ir a un lugar porque cobran mucho, la verdad. Y yo pedí ayuda para que sea gratis. Pues me ayudaron mi limpieza, me hicieron 3 rellenos, a mi niño le hicieron también la limpieza y también lo checaron que no tuviera caries. Pues a usar el floss, el hilo dental, cómo cepillarme los dientes porque yo no sabía, yo pensaba que sí sabía cómo, pero me di cuenta que no. Ahora sí ya sé qué hacer para prevenir las caries de mi niño y de mis demás niños.
One of the most disappointing things to me after over 40 years in dentistry is that caries, especially in young children, continues to be the single largest infection in childhood and also the most often untreated. And this is especially upsetting because we know how to prevent this disease, and it's a problem that we can solve. It's a problem we need to solve.
Government programs are grossly underfunded, with such low rates of compensation that most dentists are unable to treat this underserved population.
One of the biggest problems we have is the fact that there's a change in the delivery of Denti-Cal, in that we're adding a new population. That was the Healthy Families population, is now going to be part of Denti-Cal. We don't have a lot of those providers because, for one thing, a lot of them don't see young children, and the other thing is the fact that they don't get a very good reimbursement rate, and so they just really can't afford to treat these low-income children.
Every child in Ventura County deserves access to care. Every child in Ventura County deserves the support from the community that brings, again, resources and programs to children and making sure that their health, their oral health, is the priority and taken care of.
I saw a kid Monday who's 5 and needs 8 teeth extracted. Can't even have spacers yet. It's heartbreaking.
There is good news. Dental disease is preventable. And as such, we have organizations in Ventura County who have recognized and are trying to address this issue. And we have a number of dentists in this county who are providing donated dental care, both in their office for people who have no access and also through volunteering at free clinics. What we're missing is a coordinated effort with a sustainable infrastructure that will eliminate overlaps, fill in the gaps, and provide us with optimal oral health care for every child in Ventura County.
I have an 11-year-old granddaughter who doesn't experience dental pain because she has proper dental care. The reality is, in our community today, there are hundreds and hundreds of children who feel pain and the stigma related to dental disease. United Way is extremely proud to be involved in the Oral Health Summit because we intend to make a difference, working with stakeholders and partners in the community to reach out in a way that's never been done before.
The child looks to us, the leaders, the advocates, to fight for them, and it's important that we do.